Mouth taping.
Let's talk about why you should be taping your mouth shut every single night before you go to bed.
I thought she was gonna say so you don't bother your partner or some joke thing.
Breathing through your mouth contributes to a host of issues, including bad breath, gum disease, cavities, brain fog, and a weakened immune system.
Some of these things, yes, bad breath, gum disease, cavities, true. Brain fog, weakened immune system. Now we're starting to get a little into the quack space because that's not exactly true. Maybe you can have a higher propensity for getting sick, but that doesn't necessarily mean you have a weakened immune system. Brain fog also very subjective here.
And most people, myself included, breathe through their mouths at night. Taping your mouth shut before bed completely prevents that.
Well, first of all, it doesn't completely prevent it because that's a very small piece of tape. Number two, before doing this, you really should talk with your doctor to see why it is that you're breathing through your mouth at night. Some people have obstructions in their nasal passageways that could require treatment, whether medical or surgical, both are options. Some people have allergies and a simple nasal steroid spray can help and do wonders for them. Some people can just take over-the-counter oral medications. Others might realize that they have a polyp obstructing their sinuses, and as a result they can have great results with surgical options. Or you could have really bad obstructive sleep apnea and you'd benefit a lot from a CPAP device. So like, this is where like the TikTok, maybe some good advice turns into drastically overhyped advice that can become potentially dangerous.
But it is so easy, it doesn't come off overnight, and you're gonna have the best sleep ever.
I hate when people make these claims, you'll have the best sleep ever. I can't say that to my patients who are suffering with insomnia. Like, that's the difference between a random person making a video on TikTok versus a doctor giving advice. I have patients who are truly suffering and having really bad times in their lives because they can't sleep. And if I promise them great sleep and the best sleep ever with this piece of tape and they don't get it, that trust is completely broken. But in general, breathing through the nose is best. So like whatever strategy you have to do that after speaking with your doctor, I'm all for trying different things. And if you do breathe through your mouth, there are mouth sprays that you can use to keep your mouth a little bit more lubricated, like dry mouth spray.